Now, it's been 6 months since the World Health Organization declared a global health crisis connected with the disease that was then simply known as the novel coronavirus. Half a year later, the virus has infected 17 million people on every continent and killed more than 600,000 worldwide. Ongoing vigilance, social distancing and contact tracing remains key as the virus continues to accelerate and vaccines remain a distant hope. But while across Europe there has been a relaxation of lockdowns in recent weeks, hotspots in some areas and countries have led to restrictions being reimposed, and there are pockets of outbreaks even in countries which otherwise have the virus under control. The work to develop vaccines continues at an accelerated pace, with both Moderna and Pfizer launching 30,000 subject trials with a view to progressing to widespread use by the end of the year. And the US is the worst affected by coronavirus, followed by Brazil and then by India. Well, to talk more about this, we're now joined by Professor Kanta Subbarao, Director, WHO Collaborating Center for Reference and Research on Influenza, joining us from Melbourne. Thank you so much. And she's going to talk to us about the pandemic and where we are currently. And of course, we have to start by asking you about the vaccine, because that's what anyone talks about. As we said, there's a big race for the vaccine. 2 of them have reached the final stage. There's a lot of hope pinned on getting the vaccine by the end of the year, though the big challenge then will be to get the vaccine available for everyone across the world.
Sure. I mean, there's an enormous amount of activity in the vaccine development area, all the way from the concept and testing things in animal models and what we call preclinical models, as well as moving on into phase 1, phase 2, 3 clinical trials. And the pace of this has been phenomenal. What normally takes several years has been achieved in 6 to 8 months. So the pace is amazing. The number of options is also really very remarkable. So what is going to happen through the course of these next few months is that we will learn a number of things. I expect that we will learn which of these different, what we call platforms, vaccine platforms, work well to induce an immune response. We will learn, hopefully, we will learn which of them work to protect people, because there's so much disease still going around that it is possible to test these vaccines in areas where there's a lot of disease transmission and get a sense of whether the vaccines work. We will learn how long the vaccine-induced immunity lasts, which is, again, very important. And then if we have multiple players, I think that's good news. I think it's good news for a number of different reasons. One is that, we have a population, a global population of 7 billion. And to vaccinate everybody who needs to get vaccinated, we're going to need, I think, every bit of every effective vaccine that is available. So I think it is good that there are many different approaches being developed and tested. And so rather than turning it into a race as to who's first, I think it is a race to get enough vaccine for the world.
All right, so it's a healthy competition then. Once the vaccine is found, though, India will play a key role, given that we're a production hub for vaccines.
Absolutely. India will play a very important role, both in having enough vaccine for India as well as for the rest of the world.
All right, Professor, I'd also like to talk about what we're currently seeing in Europe and even in Australia, where you are. Is it a second wave or resurgence of the virus?
Yeah, so that's a good question. I don't know whether we can call it a second wave. I mean, it sounds like it is, at least in Europe, and it's a second wave in Australia. I live in Melbourne, and Melbourne is currently undergoing its second wave. That is, in fact, bigger right now than our first wave was. Nothing on the scale that is being seen in the US and Brazil, but certainly enough to worry. So why are we seeing this, and is this, should we have expected it, and can everybody essentially expect this? I would say yes, until we have a way to protect and prevent cases, I think there will be some reintroductions. And you have to remember that all the public health measures that were very serious lockdown and kind of social distancing that was instituted at the beginning was done for two reasons. One was to flatten the curve so that our healthcare systems would not be overwhelmed. So that was certainly achieved by many countries with the first lockdown. Now, what we want to do now is that when there are reintroductions, which will happen either because of returned travelers or because there were last few cases that and this is a highly infectious virus, what we need to be able to do is identify those cases and trace their contacts and isolate them and try to prevent those from going on to becoming established chains of transmission in the community. And that requires a very, very close look and lots of testing and very active surveillance and contact tracing. And one of the problems, of course, is that, a lot of people are tired of this. They're tired of the lockdown, and many people need to get back to work for their livelihoods. And so it's a difficult public health message, but everybody needs to recognize that even if they themselves don't get severely ill with COVID-19, there are many, many people in their communities, many of their loved ones, their relatives, their co-workers, and so on, that can get very severely ill. And it's very, very hard to catch up once the virus is reestablished in the community. So I think it's something that is going to require a tremendous amount of patience and cooperation, where people take personal responsibility and act on basically for the good of others.
That's right. Now in India as well, we're seeing a massive spike in the number of cases. We're number 3 in the world in terms of COVID cases, and the fastest growth rate that we're seeing in such cases. Is this something that the World Health Organization is watching very closely and is worried about?
Yes, exactly. So it's I really cannot, say anything terribly specifically because, obviously you've got experts on the ground who can address what's happening locally. But yes, any country with a large population, and this is not just true of India, it's true of any country with a large population, with the inability to socially distance, and health infrastructures, all of which you commented on, all of those would contribute. So it's something that we've all worried about in places with crowding. And you can see in some of the second waves that have occurred in some countries, it's really in the more crowded communities within their countries that makes it more challenging. And that's true in India as well.
Absolutely. And what about this issue of herd immunity? That's much talked about. Now, recently in Delhi and Mumbai, we've conducted sero surveys, and it's found that Delhi, 23% of people had antibodies. In Mumbai, 16% had them. What does this mean for eventual herd immunity? And do we even know what percentage of the population needs to be affected to achieve it?
So that's a really complicated issue. Because the level of herd immunity, which is the level of immunity in the population that is required to interrupt transmission, varies depending on the pathogen. So, and we don't know what that is for COVID-19. We do know that 20% is probably not going to be enough, but we don't know what that magic number is. And so it's a huge debate in the scientific community as to whether it is reasonable to let the outbreak run its course and hope that there are enough people infected and immune from infection that the virus will cease to spread. So I think, like many other things with this particular virus and this pandemic, it's new, we're learning a lot in real time, and we're having to change decisions and expectations based on what we know. I mean, that's the beauty of the science and the fact that people are sharing the information and making so much progress so quickly. So I think it's a complicated question. I don't think that the data do not suggest that herd immunity by just having the virus run its course is going to be enough. We are going to need a vaccine. What I cannot tell you right now is how much of the community needs to be vaccinated in order to get sort of protection for the unvaccinated.
All right, well, thank you so much, Professor, for speaking to us here at NDTV. Well, now a look at the COVID crisis in the United States. Southern and western regions of the U.S. are grappling with a renewed surge of COVID infections as the death toll in the world's worst affected nation has passed 150,000. Now we're joined to talk more about this. We're joined by Dr. Sachin Goel, interventional cardiologist from Houston Methodist Hospital. Thank you so much for speaking to us. Now the U.S. has reportedly is recording a death a minute now. If we go by these numbers, it's crossed over 1.5 lakh deaths. What is the situation currently in hospitals? How are they coping?
Yeah, this is a big, very big problem. This pandemic is like never before. The number of cases are growing exponentially over the last few months, and the number of deaths are increasing. In fact, within the last couple of days, I think the U.S. saw 1,200 deaths in a day, which is the most number of deaths since May of this year. So this is a remarkable challenge for hospitals all around the country. I work in Houston, which is a large metropolitan area. It's the 4th largest city in America. And I work at Houston Methodist Hospital, which is a major hospital system with 7 hospitals in the Houston metropolitan area. So based on just my personal experience working at this hospital system, this has been a tremendous challenge over the last several months that our hospital administration, physicians, nurses, and everybody has been dealing with on a day-to-day basis. We are, of course, now better prepared than we were 3 or 4 months ago. But the number of patients, the number of resources that is going into this to take care of patients, take care of our staff, and deliver care to COVID patients and non-COVID patients alike has been a remarkable challenge.
Right, Doctor. Also, both in India and the United States, there was a big controversy over testing. You know, there were allegations that both countries weren't testing enough. Is the testing now adequate there in the U.S.?
Yeah, testing is obviously a critical parts of, a response to this pandemic. And testing now is much better than it used to be back in March. When the tests were limited, but I think the tests have increased to a several-fold, magnitude now, to the point that, I'm not seeing a whole lot of discrepancy, at least in the Houston metropolitan area or Texas, which is where I practice. Certainly, could we do better? Yes, I'm pretty sure we could do better.
Now, more than 800 frontline medical workers have reportedly died in the U.S., according to a tracker available on The Guardian, and that is a very, very worrying figure, isn't it?
I mean, this is a huge, tremendous loss, which is irreplaceable. And not just the U.S., there are medical professionals, doctors, nurses, other allied health professionals that have lost their lives, not only in the U.S., but also in other parts of the world, including, countries that were hit hard by this pandemic, including China, Italy, Spain, United Kingdom, and I hear about people, doctors and nurses and health professionals, unfortunately losing lives in India, and some young people as well, which is truly heartbreaking.
That's right. Well, thank you so much, Dr. Sachin Goel, for speaking to us here at NDTV. Now, as many people who are suffering from coronavirus are isolating at home, a simple non-invasive technique that could delay or even eliminate the need for a ventilator in COVID patients is something called Pruning. Now, earlier we spoke to Dr. Fahim Yunus in the United States on how sleeping on your stomach could actually help COVID patients.
Yes, we call it pronation, proning therapy. Pruning therapy is in the ICU, people who are on ventilators. Just to use all parts of their lungs, we will have a patient sleep on their stomach. Actually, they're already unconscious, they're ventilated. So we will physically flip the patient over. So the backside of their lung, which was sort of closed up, will now open, and the patient will get to use the lung a little bit more efficiently. Whether it is helpful in healthy patients at home or people with COVID at home, somewhat experimental. That is why I said in my tweet as well, this is experimental. Whether it will have harm or help or how much help. We are still studying that, but it's very practical. It's simple. So when I'm tweeting, I'm always thinking of resource limited areas. I'm always thinking of that person who's poor, who has 4 children and does not have the money to throw at this problem. And that is why I believe that this is something that does not cost much. And it's somebody who's very sick and they want to avoid a hospitalization because of COVID, they might want to try.
All right, so a helpful tip there from Dr. Yunus. Well, with that, time for us to slip into a short break. On the other side, our viewer questions will be taken by Dr. Vivek Nangia. Do stay with us. Welcome back to our special viewer question segment, and we're joined by Dr. Vivek Nangia, Principal Director and Head Respiratory Critical Care Medicine at Max Saket. And lots of viewers sending in questions to us. Let's take the first one.
Like so many others, I too have been waiting for gyms to reopen. But my main concern is that a gym is a place where so many people come and go from so many different places. So how is it possible to maintain safety and sanitation of the machines after multiple people use it throughout the day?
All right, and Dr. Nangia, I'd just like to add to that also that should you wear masks and work out now that gyms are opening and people are going back?
Yeah, Gargi, it's a very valid question, and even the apprehension is very, very valid, I feel. So, initial recommendation at the outset, I want to say that if you can avoid going to the gyms, that is the best. If you can go in for some virtual classes, that would be the best, rather than going into, again, a gym which is going to be crowded very soon. So, now that the gyms are opening up, I guess some people would still insist on going to the gym because they may not be able to arrange the equipment at home and may not have that kind of a facility at home. So, few things that we need to take care of. First of all, that gym is, you have to ensure if the gym management is cleaning and sanitizing the gym properly and adequately or not. So that has to be ensured before you go back. Book your slot in advance so that you know that only limited people are coming during that period and not that the gym is overcrowded already. I'm sure they would take care of the social distancing. There would be adequate distance, at least 6 feet distance or 2 meters distance and 6 feet distance between two equipments, which is very, very essential. Every time the equipment is used, it should be sanitized again. Avoid using showers in the gym area. Probably you could come back and shower. And as far as air conditioning in the gyms is concerned, they should ensure that, although gyms are, they may be centrally air conditioned, but if possible, they could have exhaust fans or HEPA filters in their gyms. That would be lovely. Now, coming on to your question, Gargi, of wearing masks, I don't think it would be feasible to be exercising with the masks on. Therefore, in gyms, advisable would be to maintain safe distance from people as far as possible and as much as possible, and only then go there and for exercising.
All right. Well, thank you for that, Doctor. Now time for our second question.
My name is Arshdeep Singh, and my question is, please suggest the immediate first aid that we should give to a person who is suffering from breathlessness.
Doctor?
That's a very difficult question to answer on the television because, breathlessness can be due to several causes. Breathlessness could be because of just some choking in the upper airways. It could be because of the lungs. It could be because of the heart. So that's a very technical question which we need to first try and identify that what is the breathlessness due to, and only then can one say that what first aid can be given. But yes, if you know there is somebody who's an asthmatic and has now become breathless, then probably an inhaler which has inhaled corticosteroids and a bronchodilator in it would be an ideal choice. If if you're able to decipher it's a cardiac pain, then probably certain medications which act as blood thinning could be given immediately before shifting the patient to the hospital. But yeah, outrightly describing it like this, that this is the first aid you can give, is a little difficult for me.
All right. Well, thank you so much, Dr. Nangia, for answering all those questions and taking time out.
Thank you.
Now, corona warriors like doctors, nurses, paramedical staff are exposed to potential high health risks as they fight the pandemic. And one hospital in Bhopal has come up with a unique technology to help protect the frontline staff and doctors. It's a technique that involves wearing something like an air bubble on your head. Don't worry, you won't choke because it also has a tube which feeds in air. Just take a look.
Just talk to Dr. Kanta Subbarao. Sir, could you just explain what is this, because I'm feeling comfortable without N95
Anurag,
mask.
this is an air bubble. This is a concept which we introduced for the healthcare workers, for those who are going to look after COVID patients. See, COVID is basically going to spread just because of the air. If our healthcare worker is going to inhale the same air what the COVID patients are exhaling, they are going to be in trouble. So what we have done is we have made this air bubble. If you can see, we have connected this air bubble to a pressurized air line, and that air line is connected to a big compressor on more than 1,000 liter capacity, which is kept about 200 feet away from this building. So that the air which is being compressed or which you are breathing right now, that air is more or less COVID free.
And finally, BSF Jawans who recovered from coronavirus went that extra mile and donated plasma to help save lives. So big thanks to those COVID warriors. Well, with that, time for us to slip into a short break. Thanks so much for watching. Goodbye.